What I'm going to do is I'm going to find top of the sternum is the manubrium, the bottom portion is the xiphoid process. What I'm going to do is I'm going to grab a hold of the skin and I'm going to make a transverse incision. Just so I can see the bottom. Then what I'm going to do is as I get to the bottom of the xiphoid process, which is right here, I'm going to take my scissors and I'm going to wiggle until I'm into the abdominal cavity. I'm then going to make another transverse incision. And now I'm all the way down the bottom to the bottom of the xiphoid process. At which time I'm going to make another transverse incision and I'm now into the abdominal cavity. So here's my xiphoid process. I'm going to take my scissors and you can see right down in the center is the middle of the sternum. I'm going to slide my scissors in. I'm going to lift up. Slide in and lift up, and I'm lifting up as hard as I can. Lift up. Slide in and lift up. As I get up here to the manubrium, I want to watch. I don't want to be too deep, because if I do, I'm going to wind up cutting where the subclavians come in, the brachiocephalic veins come in, where they join the superior vena cava. I'm going to have a problem. Once I've cracked the ribs, you will notice that I have cut the pericardial sac, and there is fluid present. It's the formoid. But here's the pericardial sac that I'm peeling away. I'm going to slide my finger inside the thoracic cage and I'm going to feel a muscle. That muscle is the diaphragm. And the diaphragm runs this way, comes down and runs underneath the rib cage. So what I'm going to do is I'm going to take my scissors and without cutting my finger, I'm going to slide my scissors in and I am going to come right down the diaphragm. You can see the pericardial sac. That brown that you're seeing is old blood. And now what I'm going to do is I'm going to make some spare ribs. I'm going to cut the muscles up underneath the arm. Same thing on this side. There's the pericardial sac. Take my finger, run it down, and my point of my index finger is over here. Take my scissors, crack. The reason I didn't start down here is because if I have a little boy and I don't do this right, his penis is running here and it's running right down the center. And if I do a slit right down the center, I have no penis. I got Lorena Bobbitt. Okay? And you don't want to do a Lorena Bobbitt. So, there's the pericardial sac, parietal pericardium, visceral pericardium, which will be on the heart, peritoneums. So now, if you guys looking this way, take the ribs, Away they go. When you're cutting these guys, try and cut as far down as you possibly can. And please watch yourself because the ribs will be sharp. Then what I'm going to do is take a paper towel and I'm going to drain out the fluid on this side. I'm going to reach over here. I'm going to do the same type of incision. Take the ribs off. And now I have a nice big trap door. I will have to work gently up here because as you can see I've got blood vessels coming across. That's a subclavian. Part of the subclavian vein which turns into the axillary vein which eventually turns into the brachial vein. So I've got to make sure I've got gently take a piece off. Alright, haven't gotten far enough. Lift it up, lay it back, take it off. Still not deep enough. Fine. Let's take another layer. Still not deep enough, but take out a scalpel blade. Oh, come on. It's cartilage. Now gently peel back. And now all my blue blood vessels start to appear, which are all my veins. Then I get up in here and I start figuring out, okay, fine. There's a lung, pericardial sac. Peel off the pericardial sac. What do I find underneath? Oh, thoracic thymus. What else do I find? Left ventricle. Left auricle. Right auricle. Right ventricle. And then, as you pull away the pericardial sac and the thymus gland, then all of a sudden, oh no, here comes all these blood vessels. What? Yep, the aorta, the pulmonary trunk, the ductus arteriosus or ligamentum arteriosum. So, once you've got that done, you cracked it, you found the lungs, you find all the parts of the heart, then what you can do, take the heart and do a coronal incision. All right, starting at the apex, go to the base. Open up the heart. See if you can find the tricuspid valve, the bicuspid valve, the right auricle, the left right atrium, the left ventricle, interventricular septum. All the stuff that you found on the adult heart. Once you get that far, give me a call and we'll get down into the abdomen. And I did that so that I was able to see different structures. And if I screw up on this side, I've always got the other side to work on. But after taking off the ribs, I have laid back the pericardial sac. This is what they call thoracic. This is part of the thoracic thymus. Wait a minute. Nope, that's part of the lung lobe. The thoracic thymus I have pretty much removed. So I was able to, because here's part of the thoracic thymus right here, so that I was able to see the blood vessels underneath. But then, as you can see, I've got enough room and enough ribs removed that I have got a nice visual so I can see what's going on. And then I slowly took my scissors and started cutting the manubrium. the cartilage and kept cutting down and cutting down and cutting down and cutting down until I could start to see underneath this big, huge blue blood vessel right here. And that's the superior vena cava. Because here's the external jugular. Here's the internal jugular. Here's the vagus nerve. Here's the carotid artery. Here's the subclavian vein. The subclavian artery I won't go looking for until I get up here. And then what I'm going to do is I'm going to pull back this pericardial sac, and I'm going to trim back as much of it as I possibly can. And I like to play on the pig's left side, because on the left side of the pig, I've got the left atrium, I've got a left ventricle. Here's the LAD. Left anterior descending coronary artery coming down. Right here, here's a pulmonary trunk. And what I want to be able to do is I'm going to come in and I'm going to reach down and I'm going to find out, okay, fine. Here's a lung lobe. Here's a lung lobe. 3 on the right, 2 on the left. Where do they connect? I can feel where they connect. Gone. Out. Goodbye. And then what you'll notice, here's a bronchus coming off the trachea, going into my lung lobes. Why did you do that? Because I want to be able to see on this side when I pull back the pericardial sac. I want to be able to see an esophagus. I want to be able to see a descending or thoracic aorta. And I'll drain this and I'll clean this up a little bit better. I want to be able to see the pulmonary trunk. I want to be able to clean this pericardial sac out of here so that I can see where the ligamentum arteriosum comes into play, where the pulmonary artery comes off the pulmonary trunk and goes into my lung. If you do it on the right side, you're not going to be able to see all those structures. So I do it on the left-hand side. Then eventually you'll be able to find the vagus nerve coming down here and the phrenic nerve going into the diaphragm, etc. And as you can see, we did have a little explosion of latex, but that's life. It bees what it bees. Because there's the vena cava coming right down. Well, if that's the vena cava, then what in God's name is this thing back here behind the heart? Well, let's find out. Is it flaccid or is it patent? Does it look like a vacuum cleaner hose? Looks like a vacuum cleaner hose to me. The trachea. What? The trachea? Yeah. Looks like a trachea to me. And behind that's the esophagus. Whole bunch of tubes running through the damn thoracic cage.